in the front line at a major hospital in Houston. Emergency room physician. I tell you, I can't get over the story. I didn't know it. The man got COVID, so he said, I don't have to wear a mask. This is South Dakota, no less. What group fired him? What was the group?
Sanford Health. He ran the healthcare system. He waited a long period of time. COVID's generally a 3-week illness. He waited, I think, months after he clearly no longer had the illness before stopping wearing a mask. But they fired him because he wasn't wearing a mask, because they said it sent the wrong message. I don't know how that sends the wrong message. When you've already had coronavirus, I think it sends a message that you follow science.
Do you have any thoughts on the vaccine?
Yes. I think there's two categories of vaccination. The flu vaccine, it, has variable effects every year, right? Sometimes it's really effective. Sometimes it's not very effective. And then there's all those vaccines that you get as a kid that are great. You take them over a period of time when you're a child and you're immune for the rest of your life. The new vaccines that are coming out are really, really good, it looks like. The Pfizer vaccine and the Moderna vaccine look like they're outstandingly effective. And I'm going to get vaccinated, I think, later this month, is what I'm told. So I think that people should go out and get the vaccination. And I think we should thank our lucky stars that we had, if I may be so bold, had the president we had to get rid of all the regulations to enable this vaccination to come out 5 times faster than any vaccine in the history of vaccination. It's really astonishing. The president's work was great. The policy work was outstanding. And, of course, the scientists that worked so hard to create this vaccine and tried out a number of others that didn't work out are heroes.
So I have one question on that, and you know far more, so I obviously want to ask you. It's called an RNA or mRNA vaccine. It's the first to have something to do with our DNA. Does that in any way frighten you?
With any new drug, you're concerned as one of the first people who's going to get it about side effects, but I'm not too concerned about this technology. A lot of it had to do with the development of the vaccination being one that was more targeted to the exact structure of the disease, the exact structure of the virus.
Right.
So I have great confidence in it because of that. I'm not worried about how it was developed that way, no.
Okay.
And I'm willing to take the risk on myself.
Obviously.
I'm going to take the vaccination and see how it goes.
Well, listen, I just want to reaffirm to everybody that Dr. Briese is telling us, again, they actually have fewer ICU patients than they did last year. I thank you for your time. Your patients are lucky to have you.
Thank you, Dennis, for all you do.
Thank you. Appreciate it. I'm Dennis Prager, and we continue.